Every aspect of cancer treatment is individualized. And a lot of people might have a mastectomy first and then start chemo. All of those variables, I wanted to hear a second opinion from somebody whose skills I trusted.
You're not questioning somebody else's credentials or how smart they are. You just want to know for you. And just letting them know that it's okay to have the space to do that.
Everybody here is here because they are devoted to patient care. They don't want all the bureaucratic entanglements that come with being a part of a big health system. They're tired of that. 90% of their time deals with either seeing patients, researching their cases, or writing their reports about those patients. There's very little administrative time that they have to spend on anything other than doing that type of work.
What we have at Cincinnati Cancer Advisors is unique, actually, a system that is similar to none, basically. And where you have removed many of the challenges that practicing medicine faces in the US, especially, and cut many of the bureaucratic red tapes from the practice of medicine. So the physician focuses on the priority of healthcare delivery, which is the patient, and providing attention to the details and providing care for the patient as a whole.
It's really digging into the depths of how do you feel and going from a top to bottom holistic. So not only a clinical physical checkout, but also a mental checkout. Like, how are you doing overall? How is your life, progressing? How is your family? So it's getting into some intimate details, and not because they're inconsequential, but quite the contrary. It's very important to understand the whole picture. And so in talking with Dr. Lemming and talking with Jill, they bring in other sides of a conversation that I've quite never really had in a medical practice before.
Sometimes the financial aspect of dealing with hospitals and doctors' office and insurance companies is more stressful than having cancer. And when you read the pamphlets that come with the medicines, it is so frightening. And you have to remember, and Cincinnati Cancer Advisors reminds you that everybody's cancer journey is unique.
I want people to be able to feel that we listened, that we genuinely care, and that we will use all resources that exist on the planet Earth to help in all ways that we can to improve their diagnosis, their care, their life, or just giving them hope that they're not without the potential of a better day tomorrow.
Cincinnati Cancer Advisors, to me, means a completely objective second opinion, reassurance, great communication between treating oncologists. So important to have that right plan of care from the start, and that's what this is all about.
We help reiterate to the patients that they really do have great docs here in Cincinnati. We have so many unbelievably skilled oncologists here. And it's not that we're doing things that any of the rest of the physicians can't do. They just don't have the time for it. And so we really are. We're filling in those gaps.